Welcome back to the plague, to the Black Death. This is the installment where we're just going to talk about the medical responses to the plague. One of the interesting things about the arrival of plague is that it really challenged all the expected practices and theories of science and medicine. And although there was an effort to try to understand it, it's one of the things that may have pushed medical science and experimental medicine into the next stage over the course of the early modern period. There was certainly an active practice of medicine in the period. Doctors range from university-trained physicians to the practical surgeons. They're famously grouped with the Guild of Barbers, and you can think about the razor that was used in both practices. Midwives, of course, and folk doctors that emerged from the local community. Most of the most educated of these, and the ones that participated in university learning, were the university-trained doctors who had been practiced in Latin and fluent in the language from Galen, the language of medicine that they inherited from the 2nd century Roman medical writer, who really was so influential up until the early modern period. And because these were the folks that traded in university culture, and they're the ones that mostly wrote stuff, they constitute the biggest set of sources for our understanding of the medical responses. And they were consulted up and down the line. I asked you to read for this section the response from the University of Paris faculty, the medical faculty from the University of Paris, in a memo to the king trying to explain what was going on. We'll come back to that in a minute. So, how did doctors understand the onset of plague, and then how did they combat it? That's really the issue here. And one should say that while they sought natural causes, and that's mostly what we're going to be talking about, that is, they're looking for a rational, or what we might call secular or environmental causation, rather than the act of God, right? The divine decision. They didn't need to. They were able to reconcile the natural and the divine interpretation in the sense that everything was part of God's plan. The movement of the stars and the earth and the planets were all part of God's plan, and we'll see some evidence of that later. So medical science in the 14th century was rooted in the Galenic view of human health, which was predicated on the 4 humors. And the idea was that the macrocosm, right, the natural environment, related to, was both metaphorically and causally to the microcosm, and thus the body. And so a healthy body was defined by the balance of the 4 humors. The healthy macrocosm was another type of balance. We'll get to that in a minute. And the imbalance, illness in the body, was caused by that imbalance which created illness was caused by or related to an imbalance in the universe. Just take a minute here and look at what this was. So the macrocosm was the stars in the universe and the earth, and was made up of 4 elements: earth, water, air, and fire. And it had it was causally related to the 4 humors of the body: black bile, phlegm, blood, and yellow bile. And in the chart you can see that each of these is associated with a quality, and that itself suggested or dictated basically personality, temperaments. Because of the correspondence between the secular sphere, right, earth, air, water, fire, a disbalance in the earthly environment could lead to a disbalance in the body and thus create illness. And it would affect some in different ways depending on their internal makeup. This led to the theory of illness, the miasma theory of illness, which was what was believed to cause plague, which was that there was a corruption or a kind of poisoning of the air, or sometimes the water, which would then in turn throw off the balance of the humors in the body and cause illness. And this was useful because the plague seemed to be so everywhere, right? Air could seep into the house, it couldn't be kept out, and it seemed to help explain, or it was in consort with it, the seeming sort of ferocity and indiscriminacy of the disease, and in a way that seemed hard to combat. So the physicians looked to the causes of plague, and so they looked to these environmental changes. But it's clear that they did not need philosophically or intellectually to separate that physical environment, those secular causes, from the religious interpretation that we spoke about last time. And here I'm just going to go back again to Gabriel de Musis's account, and in imagining God's speech, right, he talks about the judgment that he's pronouncing upon mankind, the death that he is raining down in anticipation of the last judgment. And he says, I've highlighted it here, that he is instituting dissensions, disasters, plagues, robberies. Next, at my command, let the planets poison the air and corrupt the whole earth, right? And so the poisonization that came from what we'll see as sort of a series of understandings of astrological movements was ultimately in consort with the religious interpretation. Okay, so let us just talk a bit about the representative report from the medical faculty at Paris. The most common explanation for the secular interpretation was to marry these Galenic theories to practices of astrology. And most of the writers attributed the changes in the atmosphere, right, that poisonation of the atmosphere, to a particular alignment of planets, Mars, Saturn, and Jupiter, that had occurred in 1345. And so in this is the view that the medical faculty suggest, and they explain that the first cause, right, the principal motivation, or the thing that began the cycle of poisonation of miasma, was the alignment of the planets, and then that in turn caused the corruption of the water and the air, which when breathed caused plague. So they also said that plague was most harmful, or people whose bodily humors were, let's go back to that, hot and moist. So people that were sanguine, that had an excess of blood, were most susceptible to catching plague. Paris doctors, and a number of them, there's a lot of plague treaties that are written after 47, 48. The doctor to the Pope wrote one. You see a number of scientific writings with different versions of the same diagnosis and advice. But you can see the Paris doctors offered a series of prescriptions for health and how to ward off plague. So they included fumigation, right? They tell you what kind of wood to burn in order to combat the poisoned air. They suggested that you should avoid vigorous exercise, quote, because such exercise causes much air, which is foul and poisonous, to be drawn into the heart. You can see the worry was that you were just taking in more of this poison. You weren't supposed to overeat. You should try to consume vinegar, sorrel, orange, and lemon juice, and any other acidic foods. The medical authorities said that, quote, clear fresh wine is better than sweet wine, because wine that contains sweetness putrefies more easily and has a greater tendency to turn into bile. He said you should sleep a lot, you should abstain from sex, and you shouldn't bathe too much. And again, here the worry was that the water was poisoned. And above all, because of course, if you were hot and moist, you had an excess of blood, you could be purged through bleeding. Let's see, I have a picture of that, right? They were cognizant. The practice of bleeding, purging through blood, was a common practice in the Middle Ages in order to rebalance the humors, but the doctors were cognizant that you couldn't overbleed. The miasma theory of the disease didn't include, or it was able to accommodate the notion of contagion. Certainly, common experience seemed to indicate that the disease spread through contact. And actually, the word contagio in Latin, contagious, simply means contact. That's where the word comes from. And so there was an attempt to then reconcile this miasmic interpretation with the idea that it was transmissible from one person to the other. Again, to go back to Gabriel de Mussis, he says, this is on page 17, moreover, one infected man could carry the poison to others and infect people and places with the disease by look alone, that it could be passed through look. People thought that once once somebody died, they were releasing the poison into the atmosphere, thus further making contagious the air around it. Islamic authorities thought the plague could be carried by birds. We know, of course, that it required the intermediary of a flea bite, but it did seem, and they were trying to reconcile the understanding that whole households, once one person got infected, everybody did. Super interesting. Snowden does a very nice job in explaining that plague is probably the thing that, probably the factor that pushed medical science in Europe to break out of the Galenic stronghold, which Galen's, the stronghold that Galenic thinking had on the practice of medicine, and to push beyond the Galenic Hippocratean view of humors as the cause of the sort of central basis of understanding the illness of the human body. This doesn't happen until the 16th century. But people did understand the need for cleanliness, for protection, and particularly for quarantine. And so one of the things that you get is a series of public health measures. One thing that all the commentaries say, all the plague say, is that there weren't enough doctors to go around, and that doctors were dying. Doctors and priests, in fact, were dying in extraordinary numbers in their effort to help the sick. This is a famous image from the 16th century of a plague doctor, and you can see there's an effort to create a protective aura to stop the contagion. Gloves, that weird beak would have been stuffed with herbs in order to try to again prevent to purify the poisoned air. And there were glass eyes in the glasses frame. And we see this as the beginning of a series of public health measures, mostly in northern Italy. So this is going to sound familiar. A number of city-states established travel bans, actually as early as 1348. The city of Lucca banned anyone entering from Catalonia, Genoa, or Romagna. Quite soon people had to begin to carry bills of health, clean bills of health. Quite early on, you see the beginning of quarantine. So ships would arrive and they would have to stay on deck. This again sounds familiar. They would have to stay at anchor and not disembark until it was determined that everybody was sick. In Dubrovnik, actually, is our earliest example. In 1377, the city of Dubrovnik on the Adriatic coast established a law whereby people coming in to the city would have to be isolated for 30 days, and they established an island off the coast where they would have to go stay before being able to come onto land. The second example we have is actually where we get the name quarantine. This is Marseille in 1383, and they chose the period of 40 days. Quaranta, that's where we get the word quarantine. Quaranta is a 40-day period. It has some sort of biblical resonances. Why 40 days? And a series of coastal cities that had a lot of maritime activity continued, adopted the practice pretty early on. In Germany, just some other examples, in Germany, any linens or textiles had to actually be set aside for a full year before they could be sold once they entered the city, although I like this, and it's, again, the idea was that textiles could absorb and keep the air, but of course they could also absorb and keep fleas. But anything that was smooth and hard, so like wood products, only had to be quarantined for two weeks. And so you begin to see this idea of cleanliness and protection, obviously aided by cities that had city walls, and this develops quite actively in the course of the 15th and 16th century as states develop and the state apparatuses and the structures of bureaucracy could manage to implement and enforce them. This is a watershed both in terms of the development of medical science in the 16th and 17th century as they pushed beyond Galenic frameworks for medicine and also for the notions of institution and trying to enforce public health. Okay, good. Next up is art and culture.